What are your strategies when dealing with a knee pain patient who's avoiding squatting, dorsiflexion, knee flexion, hip flexion? We could give them weight into a goblet squat, which should help them facilitate more muscles because you have resistance pushing them down, recruiting more muscles to pull them into a normal squat. But what if we have somebody who's had this problem for a long time? They've been told squatting's bad, don't let your knees go over your toes, or they're just fearful of having weight. We could regress that and have them do a post squat where they're just using a post, but we don't want them hanging back and avoiding dorsiflexion. So we want to cue them to push forward, try to look down and see their knee rather than their toes, which means now they've got dorsiflexion, knee flexion, hip flexion, lumbar flexion into a butt wink, which is what we want. So go ahead and do a couple of those. So goblet squat would be the best way to do it, 20 to 30 pounds depending on who your patient is. Then if they can't do that, start off with this. Then once they break the cycle, they get proprioception back so they understand this is a safe position, then you can have them go back to a weight-resisted goblet squat, and they should do much better. And that is a way that you can keep from trying to work around the symptoms and actually attack the problem and send them home with homework, which will make them better.